Every winter, a dense smog descends on the Indian capital, making the lives of its some 20 million residents miserable. As in previous years, the toxic air poses a major health risk to the city's children. Ruchi Manjal is very concerned about her 3-year-old daughter, Anaika, who suffers from shortness of breath and a severe cough.
We take help of medicines at times. We have the visits to the doctors are very constant these days for children of this age group. So the situation is not at all good.
The family was even forced to buy air purifiers to help the air quality at home. The situation has also become critical in the capital's schools. After a week of no classes, this Delhi primary school is open today, despite the high level of pollution. But while classes have resumed, there is still a complete ban on outdoor activities.
How are you all?
Ridhima Karyal, a senior teacher, says that toxic smog in Delhi puts her students at grave risk. The majority of the children suffer from severe coughs and sometimes even faint. But the schools face a dilemma.
As a teacher, the biggest challenge is the students' health is very important, which we are trying to maintain. And second biggest thing is that we don't want the schools to be shut at this time again, because the 2 years pandemic has actually deteriorated the education quality of the school and the students as well.
According to the latest report from State of Global Air, more than 100,000 infants in India died within a month of birth due to air pollution. Another study has shown that 1 in every 3 children in Delhi has impaired lung function. This hospital in New Delhi is experiencing a surge of patients because of the city's toxic air. Pulmonologist Dr. Nikhil Modi has seen hundreds of patients, mostly children, suffering from respiratory problems. He says that situation is alarming and believes that Delhi's toxic air could trigger a serious health crisis.
Children is a very, very vulnerable group because they are young, their lungs are still in the development phase. So during the development, due to the exposure to so much of pollution, their lung before getting developed can get damaged, and that damage can be permanent.
The Indian government is currently working on an ambitious clean air program. They aim to cut air pollution by 40% over the next 5 years. That is a long wait for children like Anaika, who will in the meantime likely develop breathing problems that might be with them for the rest of their lives.